Meeks from Iowa for 5 minutes of questions.
Thank you, Mr. Chair, and thank you to the witnesses who are here. As a physician and a former director of the Iowa Department of Public Health, in March of 2020, as a state senator, our legislature went into pause. At that time, I recommended to our governor and to our legislators that we not close schools, especially elementary, because the data we had at that time, the scientific data we had at that time, indicated that children were of minimal risk and did not seem to be good transmitters of the virus. Later, I submitted to our Senate the American Journal of Pediatrics article in June or July of 2020 that indicated that there was very low transmission, and at that time recommended that schools should not be closed, but the CDC did not follow that guidance. So beginning in March of 2020, schools across the nation began closing, which seemed to be not unprecedented, given that we did not have as much data about the SARS-CoV-2. That led to a complete transmission of classrooms to virtual classrooms. The impact of those decisions are no secret. The Pediatric Journal of the American Medical Association reviewed 36 different studies comprising almost 80,000 children and adolescents, as well as 18,000 parents, and concluded that school adolescents or that closures were related to adverse mental health conditions, distress, anxiety, health behaviors, and obesity among children and adolescents. I argued at the time in my first year in Congress numerous times before this committee and before Dr. Walensky and Dr. Fauci and others that schools reopened in Nevada. Published article, schools reopened in January of 2021 because between March 16th and June 30th, there were 6 youth suicides. Between July 1st and December 31st, there were 12 youth suicides, the youngest of whom was 9. So, Dr. Hogue, are children less susceptible to COVID-19 infections than adults?
So early on in the pandemic, we saw that they were less likely to be infected, but they've always been much less likely to experience severe outcomes. And I discussed that's greater than 1,000-fold difference between children and older adults. And that continues to be the same in terms of severe outcomes, that children are much, much less impacted. And it's comparable to a typical seasonal flu year, their infection fatality rate from COVID-19 to seasonal influenza. So we should have been taking that into account from the beginning, and it's even lower now from COVID-19, considering the amount of immunity children now have.
And do we close schools or require mask wearing for children during the influenza season?
No, we do not, yeah.
Thank you. And do children transmit COVID-19 to adults at a high rate?
So children do transmit COVID-19 to adults. What we saw, especially early on in the pandemic when we were doing contact tracing, is that children were much less likely to transmit to others outside of the home. They could transmit to adults outside of the home, but at a lesser rate. And in school, the transmission rate to adults was minimal to almost none in numerous studies from Europe, from the United States, from my own work in Wood County, Wisconsin. We saw no transmission from students to teachers in our Wood County, Wisconsin study over the fall semester, and we had the same experience in California.
Yeah, when we had Dr. Walensky before us in testimony, I asked her if she inquired in other places other than the American Federation of Teachers Union about school closures, and she said she did. I asked her to submit data that had not been submitted to this committee. I also specifically asked her if she checked with the state of Iowa. Iowa reopened its schools in the fall of 2020. There was not big drivers of community spread, and did you see other schools that were drivers, especially elementary school, drivers of community spread?
No, and I think it's important that we actually look at data from Europe that, independent of what the mitigation strategies were or what the country was, there was no relationship with the school reopening and the community case levels. And we also saw that in Brazil with community case levels and with severity of disease outcomes, that whether or not they opened or closed schools had no impact on community transmission.
Yeah, and we asked if the CDC and FDA both would look at real-world evidence of other countries as they developed policy. When did this data become clear? And if you could answer very quickly, because my time's almost up.
In the late spring and early summer of 2020.
Thank you for that. I'd like to have entered into a record an article from Contemporary Pediatrics, March 23, 2023. Pediatric speech disorder diagnosis more than doubles amid COVID-19 pandemic. That's related to mask wearing. And do children need to wear, did they need to wear PPE?
No, we have found no evidence from the best studies that we have that masking children provides a benefit. Best study we have actually is from Spain, a regression discontinuity study that found no evidence of benefit, and children in Scandinavia were not masked under the age of 12, so it's important to keep in mind.
Thank you so much, Mr. Chair. I yield back.